Welcome back. Today we have on Sharika Benjamin, and she is with Genomics, and they are up in Fountain Valley. You've been on here before, and nice to have you here again. First of all, let's go over what you folks do, kind of in a simplified form. What is I'm going to try and read this right. Pharmacogenetics.
Yes.
Did I pronounce that right?
You did pronounce that right. Pharmacogenetics, basically, pharma is with pharmacy, pharmaceuticals. And genomics is basically your breakdown of your gene, your DNA. So together, pharmacogenetics is basically the breakdown of gene drug to drug and gene interactions.
Okay.
So if you're taking medications, any kind of type of medications, pharmacogenetics test is basically to tell the doctor and to tell the patients which drug is right for you. So it's personalized care. Yeah,
that sounds like the way to go. And this is something that is fairly new technology, right?
It is fairly new. It's the cutting edge right now in scientific and with the physicians on hand.
So what part in that do you folks play? Are you, you take the genes, you just take a swab, do you need blood? How does that work?
Sure, so we're the laboratory, and what we do is we work with your doctor on a one-on-one basis and as well with the patient. And so we basically give a swab to the patient and ask the patient to just do a 30-second swab.
Okay.
And I take that swab, or the nurse or the doctor or whomever is taking the test will just put it in an envelope, send it off to our laboratory in Fountain Valley, and we basically extract your DNA from that little swab. And it's a lot of process to it, but it's very precise. And when we analyze your DNA, we're cross-referencing it with all the genes on the market today. Okay.
Now, obviously, people are going to ask about the privacy issue, right? About you guys are handling somebody's DNA, and how is that process? You know, people might have fears. Was this going to be released to the insurance companies or to government, or those are real questions to me.
Yes, it is. And the doctor, you're consulting with your physician.
Okay.
You're consulting with your doctor on a one-on-one basis. This is between the patient and the doctor. When it comes to the laboratory, we're clinicians and scientific and lab techs. We all have to know within that circle, and we don't just, we never ever put anybody's business out.
Okay. I mean, that's an obvious question people are going to ask.
And then the insurance will basically get informed about what is being processed, because this test is definitely the way to go.
Okay. And as far as the usage of it, how is that doctor with that information going to look at that and be able to pinpoint what is the right medication for someone?
So let's say you come into the doctor's office and you have a problem consisting with heart medication or heart problems. The doctor is using this pharmacogenetics test to basically guide him as a roadmap, using different pathways which certain medications is going through your body. So the doctor is checking to see how you are breaking down this medication, how you are mutating with this drug and interacting. Is it working properly? Is it causing different, interactions? Is it going to lead to to something else, worse, know?
So that way they can, you always hear on the commercials about a certain drug, this is for your asthma, but oh, by the way, this can also kill you.
Right,
exactly. I mean, they basically say that.
It's if you develop different kind of, and that's scary to take,
And so this way it can be pinpointed.
Oh, it's precise precision medicine right now. This is the only leading way to know which drug is for you versus clinical study. 75% of all people have this genetic variant. In a clinical study, all these drugs are being tested just on a certain, just a certain group.
Right.
But if you go worldwide and you go one-on-one, not one glove fits all.
Of course.
It's definitely, it's unacceptable to use that standard now. So we are now focusing on a one-on-one level in healthcare because that's the best way to go. We want to get this right to the T. We want to make sure that we are caring for you and we're doing our part in helping you with this problem and caring for your treatment, you know.
How widespread is this? In fact, I guess what I'm saying is, how many doctors are in tune to use this? And how far widespread is it gaining ground? I know that quite often when it comes to pharmaceuticals and different types of medical advances, Southern California is really one of the leaders in the nation on that.
Right.
So how far has this gone so far, and how does one communicate to their doctor, I'd like to get this done?
Well, the American Medical Association is all about this. The Heart Association is about this. The Cancer Association is about this. I mean, the pharmaceutical companies is about this because they want to sell, you know, they want to make drugs that are perfect, you know. So right now, everybody in the healthcare, nurses, doctors, and I'm also a nurse as well. I've worked as a licensed practical nurse. This is a great way to care so we don't suffer, so the patients are not suffering anymore. So we basically go to our doctor and explain we're tired of suffering. We're tired of taking medicines that we don't even know how to pronounce anymore, or tons of medications just laid out on a table, 1, 2, 3, 4, and by the time I take my 6th pill, I don't even know what else I'm taking, you know, but I would like to know an easy breakdown. Tell me what is this, tell me what exactly I need for me. Don't just try something on me. Don't just say, oh, this is what you have. So that's how you go to your doctor. You tell your doctor, you know, I have a problem. This is my list of medications. I need help in understanding how to, you know, which medicine is right for me. And I need you to understand as well.
Okay,
as a doctor,
so from that point on, does the doctor, the doctors or the medical group interact with you then? That's how that works.
Yes.
It's not, I guess what I'm getting at, does the patient themselves interact directly with you, or must it go, goes through their doctor?
No, that they have to go to their doctor. This is a clinical setting. See, it's private. It's HIPAA regulation. So you don't, this isn't something you can just go into a pharmacy and just say, I would like to take a test, you know. This is just as a one-on-one consultation with your physician. And once you talk to your physician about it and let them know that you've, you know, heard about this genetic test, and you know, you heard about lab genomics testing here locally in Fountain Valley, you know, I would like to have my test done.
And do you know if this is handled by a lot of the Medicare groups, the Medicare Advantage and things like that?
Oh, definitely.
Because it sounds like more as what they look for more and more nowadays is prevention. And wellness, and this seems like that would certainly do that.
This is the leading way in predictive, preventative, and personalized care. You said it right there. You know, the physician and the clinicians and the patients and the pharmaceutical all work together in a comprehensive way. So there's the Medicare, the PPOs, the HMOs, even we deal with the low income base. This is needed. This is not going away. This is mandatory.
Well, great information, and I think if people want more information, they can go, they can call you folks, because they can certainly call you direct and say, okay, what do I say to my doctor?
And call the laboratory and say, you know, we heard and we'll guide you all the way through. You know, we want to help educate and just get the word out there.
And will you be able to tell them that here's the program that I'm with, my Medicare Advantage, my doctor group?
Definitely. I'll consult with them, and we deal with all insurance. We take care of all leading insurance, and if a person comes in with no insurance, we work with them too as well.
Sharika, thank you very much. It's good to see you
again.
Thank you. And their number is 949-641-55. And we thank you for the information. It's nice to see you here again. And maybe we'll see you again soon.
Thank you. I'm glad to be back again, and I'll be back again if you invite me.
You take care, and we'll be right back.